Hey everyone, my name is Dr. Shrikanth, consultant pediatrician, Rainbow Children Clinic, Siripuram, Vizag. Have you parents anytime wondered why my child is not gaining weight? He is becoming fatigued very early. He is not interested in playing anymore. He is not gaining weight. He is losing interest in studies. Probably anemia may be cause for that. Today I will be telling about anemia. Anemia is defined as decrease in hemoglobin or red blood cells. There are different cutoffs for different age groups. Generally 6 months to 5 years, if it is less than 11 hemoglobin, we consider it as anemia. From 5 years to 12 years, if it is less than 11.5, and about 12 years, if it is in girls, if it is less than 12, and in boys, if it is less than 13, we call it as anemia. Why am I telling this anemia now? Because recently we have seen there is increased incidence of anemia in Indian kids. Almost 24% of school kids and 28% of adolescent kids are anemic. So what causes anemia in my kid? Everyone know only iron deficiency. That's not the case. There are many causes for iron deficiency. Like example say, first is most common is nutritional anemia. Not only iron, even vitamin B12, folic acids and other micronutrient deficiency also causes anemia. When there is adequate intake of food, when there is decreased absorption from the ingested food like causes of the gut or hookworms, then also anemia can happen. When there is adequate absorption and when there is inadequate production of hemoglobin from the body, that also causes anemia, where shape of the RBCs may not be correct, where the hemoglobin structure may not be correct. After producing, if there is increased destruction of RBCs, then also anemia occurs. And when there is increased requirement, especially in kids and adolescents, the anemia occurs. So what are the signs and symptoms of anemia? How do I know my child is anemic? Usually when anemia is mild, the symptoms and signs are very mild and it is usually not appreciable. When there is mild to moderate, if it persists for longer time, it affects a long-lasting side effects on brain, where it is noticed that the child's memory, cognition skills, solving problems are all affected. So signs are generally baby gets usually fatigued early, he is less interested in playing, his growth is disturbed, he is not growing properly, his appetite is decreased, he is less interested in studies, and he has more chances, more recurrent infections. And in anemia, there is more chances of infections also. So even if parents think my child is having anemia, you better to consult your pediatrician. So how do we treat anemia? Based on the cause. First we take proper history and examination and we see for the pointers for the cause of anemia. Generally we do blood testing where we find what type of anemia is there, and in Indian kids most common it is nutritional anemia. So how do we treat that? We give iron supplement, we do deworming. Iron supplement injection means taking iron syrups or tablets. I'll give few tips. Just it should be given in empty stomach. It should not be combined with food, especially milk, where the absorption of iron doesn't occur. So how do I prevent iron deficiency in my child? Give a lot of iron rich food, especially avoid milk and fatty foods and processed foods and all kind of junk foods, and give lot of green leafy vegetables, iron rich jaggery and fish, egg and dry fruits, etc. So be aware of the symptoms in your child and be safe. Thank you.